Hey there, let's solve some questions on this topic. Let's look at some questions on ischemia and infarction, and hopefully this will help us with our test. Okay, so question one tells us that what is the name of the phenomenon where repeated brief episodes of ischemia protect the myocardium from a subsequent prolonged coronary occlusion? And then the answer is ischemic preconditioning. So ischemic preconditioning is a protective mechanism in which short, non-lethal episodes of myocardial ischemia activate cellular pathways that reduce damage in a longer period of ischemia, if a longer period of ischemia occurs later. It essentially makes the heart more resistant to infarction. Okay, now let's look at question 2. So for question 2, where is angina typically localized? And the answer is retrosternal chest pain or discomfort, often radiating to the left shoulder, left arm, neck, jaw, or occasionally the back. And patients usually describe the sensation as pressure, heaviness, tightness, squeezing, or burning rather than a sharp pain. Let's look at question 3. So, which of the following is a common trigger of angina? And the answer is physical exertion or exercise. Exercise increases myocardial oxygen demand. When coronary arteries are narrowed by atherosclerosis, oxygen supply cannot meet demand, resulting in myocardial ischemia and angina. Other common triggers include emotional stress, cold weather, and heavy meals. Let's look at question 4. How long should angina usually last, and what condition should be suspected if it lasts longer? So stable angina generally lasts less than 20 minutes. If chest pain persists for more than 20 minutes, especially at rest, an acute myocardial infarction should be suspected until proven otherwise. And persistent chest pain represents ongoing myocardial injury and requires urgent medical assessment. Let's look at question 5. Which of the following is classified as a coronary syndrome? And the answer is stable angina pectoris. And stable angina develops because of fixed coronary artery narrowing and predictable myocardial ischemia during increased physical activity. Unlike acute coronary syndrome, symptoms remain relatively stable over time. Let's look at question 6. Which of the following is classified as a coronary syndrome? And the answer is stable angina pectoris. Stable angina develops because of fixed coronary artery narrowing and predictable myocardial ischemia during increased physical activity. And unlike acute coronary syndrome, symptoms remain relatively stable over time. Let's look at question 7. So, according to Canadian Cardiovascular Society functional classification, which class involves angina during minimal activity or at rest? And the answer is class 4 angina. So class 4 angina patients experience symptoms with almost any physical activity and may even have angina while resting, indicating severe coronary artery disease. Question 8. Which of the following contraindication to exercise stress? Which of the following is a contraindication to exercise stress testing? And the answer is unstable angina. So exercise stress testing is unsafe in unstable angina because increased myocardial oxygen demand can precipitate myocardial infarction or serious arrhythmias. Now let's look at question 9. So question 9, what is the target heart rate during an exercise stress test? And the answer is the target heart rate is around 85% of the age predicted maximum heart rate. So the formula is target heart rate is equal to 0.85 or 85% times 220 minus age. And this level of exercise provides adequate cardiac stress to detect myocardial ischemia. Let's look at question 10. So question 10, what does a Duke treadmill score of less than minus 11 indicate? So the answer is a Duke treadmill score of below minus 11 indicates a high risk of severe coronary artery disease and predicts a significantly increased risk of future cardiovascular events. These patients often require coronary angiography and consideration for revascularization. Let's look at question 11. Question 11. Which non-invasive investigation can correctly diagnose ischemic heart disease in up to 95% of patients? And the answer is stress MIBI scan, and it's also known as the technetium 99M, some long name, but just know that it's the stress MIBI scan. And this investigation compares myocardial perfusion during exercise and addressed to identify areas of reversible ischemia and previous infarction. Now let's look at question 12. So question 12 is which of the following is a mechanism of action of nitroglycerin? And the answer is nitroglycerin causes vasodilation. Its major effects include venodilation, reducing preload, and arterial dilation, reducing afterload, decreased myocardial oxygen demand, and improved myocardial oxygen supply. And these effects rapidly relieve myocardial ischemia and angina. Let's look at question 13. Question 13. What is the recommended long-term aspirin dose for stable angina? The answer is 80 to 150 milligrams once daily. Low-dose aspirin irreversibly inhibits platelet aggregation, reducing thrombus formation and lowering the risk of myocardial infarction. Question 14. Which of the following is a common side effect of beta blockers? And the answer is bronchoconstriction, particularly with non-selective beta blockers. For this reason, beta blockers should be prescribed cautiously in patients with asthma or chronic obstructive pulmonary disease. Other side effects include fatigue, bradycardia, hypotension, and sexual dysfunction. Question 15. What is the restenosis rate for stent implants compared to PTCA alone? And the answer here is with PTCA alone, restenosis occurs in approximately 35% of patients. With coronary stent implantation, however, restenosis falls to approximately 5 to 20%, and this significant reduction explains why coronary stents have become the preferred method of percutaneous coronary intervention. I really hope that these solving of questions helped a little bit, and hopefully that little bit can go a long way, and hopefully one day we can be good doctors. Bye.